Good morning, y'all. It's Vichelle Johnson. I'm the intern here at Swope Health, and I'll be taking over UA's Instagram account for today and just walking you guys through like my daily routine and what I do once I come to Swope and my experience today and everything. So, see you there. Okay, so just a little bit about me. I'm a rising senior at Fisk University in Nashville, Tennessee, and I'm a joint major for bio on the pre-med track in business. Usually when I get here, I clock in, obviously, and then check my emails and respond to those that are needed. So I do have my own office here at Swope, and my agenda varies by day. I'm usually meeting with different departments and shadowing them and asking them questions. I'm actually on my way out to meet with the OB department today, so that should be exciting, and I'll check in with you guys after. Okay, y'all, so now I'm just going to show you guys a couple of the places that I went today. We're going to start with OB. We're going to hit on optometry and just talk about what I did there. Okay, y'all, so this is OB. Obviously, you walk in and you have your wonderful receptionist who's going to check your patients in. I spent the day with Dr. Satija. You can see her picture up there. And she was really wonderful. You know, she explained a lot of things that out and just further cemented me and wanting to be an OB. Right now, I'm sure she's back there with patients, and obviously I'm not going to show you guys patients, but we did things like she showed me her doing pap smears and just like exams on her patients and everything, so that was great. All right, so after stepping out of OB, I would say my favorite thing that I learned in there, besides getting to meet with the patients and getting to observe, which I'm very grateful that they allowed me to, would be how to correct the effects of birth control, because a lot of women deal with effects such as extensive bleeding and having cycles longer than 30 days. And so you can correct that with like estrogen pills or something of that sort for about 12 days, and then it should resolve itself. All right, so now walking out of OB, we're going to walk right over here to optometry in the Vision Center. And while we're on our way there, one thing that I said is really great about Swope that I'm sure a lot of people know, but I've learned even more about how extensive they are with this, is they help the less fortunate. They help those that are underserved. So a lot of people in here either don't make enough or something of that sort, so they just help them get coverage. So the optometry center, I had a meeting in here. You guys, it works the same way. So you have your receptionist, they check the patient in, and then they go back and they see the doctors. They do pretty much the regular eye care, eye testing for glaucoma and things of that sort. They diagnose a lot, but if there's anything surgical or they want something like LASIK, then they will outsource. And sometimes they will just go to another hospital, and the hospital grants them privileges, and they'll. All right, and my third meeting of the day would be behavioral health, and I'm just going to go ahead and head down there now. We should be talking about what projects I'll have. They're providing 2 other projects, and my third one will come from the chief executive officer, which would be Jared. So after they go ahead and tell me what I'm doing, then I'll come out here and I'll let you guys know what projects those are. And then my last and fourth meeting of the day would be with the CEO at 12:30. So we'll head back there. All right, so now we are leaving that meeting and going back to my office to prep for my next meeting with Jaren. And that is pretty typical. Like, I do have meetings often, but I like it because not only do I get to interact with other employees, I also get to interact with patients and learning from their side of things, as well as it being in my field. And just a bonus is that in introducing me to all these different departments, they are essentially showing me not only how the medical aspect works of a hospital, but also how the business aspect works, which I feel like is something that a lot of doctors don't understand. So, okay, y'all, so getting out of my meeting with Jaren, I now have my full list of projects for my time here. 2 of them are from behavioral health, as I said before. One is on gun violence, and the other one will be on podcasts. And Jaren actually gave me 2 instead of 1. So one of them will be on pediatric mental health urgent care and all the information that concerns that, because we don't have one within the state, so he just wants to see about that. And then the other one, I have a choice of either leadership of color in KC medical programs or research on the Swope sites and all the information regarding that. Okay, so now I'm going to go ahead and clock out and submit my time card and everything and go home. And then we have an event tonight. It's called the Summer Sizzler, so I'm going to get ready for that, and I'll check back in with you guys then. Yes, I feel like UA prepared us for college classes in terms of like the education picking up right where it left off, even though study habits did have to switch. But for internships, I feel like they taught us what we needed to know, but it worked in collaboration with the college experience. In a way, I feel like Swope chose me more than I chose it, but I really did like the experiences that I heard from previous interns, as well as when I interviewed with my current manager, all the opportunities I was excited about. So lastly, we're just going to hit on my advice for people going into internships or currently in them. I would say the three most important things are to be present, to be open, and to be proactive. And by that, I mean, in order to be present, you need to be able to ask questions relevant not only to what's important to you, but to what they're talking about, because that's going to influence your whole experience out of the internship. And as far as being open, you should approach the internship with a generalized outlook in terms of, even if you know what you want to do, be open to the different things that they're going to introduce you to, because it might change. And lastly, proactive, that includes everything, like being prepared in everything, having everything you need to know.